Good morning. So I'd like to welcome you all this morning to the University of South Wales Newport City Campus for this very auspicious day in our calendar. And it gives me great pleasure to firstly welcome Dr. Alison Strode, who's the Chief Therapies Adviser for the Welsh Government. And we're absolutely delighted to have her speak for us this morning. Thank you very much. Alison.
So it's nice of you to clap me. I don't know what I'm going to say yet. So thank you very much for inviting me. I'm absolutely delighted to be here. As the slide says, I'm Alison Strode, and I've been a Chief Therapies Adviser for the Welsh Government for the last, coming up to 6 years next week. It's sort of a slightly confusing title because some of the professions I cover would say they don't actually deliver therapy. They sort of deliver treatment. Others who do deliver therapy are actually not covered by my role. So I'm sort of here really to deliver my talk to the sort of mainly the arts therapists, but actually what I hope is those sort of other professions represented here or the groups represented here will actually take something away with them today as well. So, as I say, delighted to be here, and this is clearly a very important and exciting time for you as a university, with the launch later of your USW therapies and the opening of your new Helen Kegie Centre. Just to let you know, it's actually a very important time for me as well. I am due to retire on the 14th of July after 30 years of what I can truly say is full-on work. I'll explain to you later, but I won't tell you yet what I trained as. But as part of my sort of preparation for this talk, I was sort of pondering, where have I come from? 38 years seems like a long time. It is. And I was sort of reminded of a colleague of mine who I trained with. He was a mature student. He'd actually been a car mechanic. I will tell you what I do. I trained as a podiatrist, and then he trained with me as a podiatrist, and we ended up working together over in Bristol. And I think he thought that podiatry was going to be basically a bit of a rest, but I think after a number of years of doing it, then clearly it wasn't. Actually, it was very full on, and sort of thinking about, what I was his manager, what I would say to him at the time, I came across a poem that I thought I would read to him. And thinking about that poem, actually, when I sort of thought, let me remind myself of it, because coming up to retirement. And when I looked actually at the poem, I realised that the poet is from Newport. So I thought, actually, what I would do is I'd read it to you today. So the poem goes like this. It is William Henry Davies. Hopefully you've all heard of him. So what is this life if full of care? We have no time to stand and stare. No time to stand beneath the boughs and stare as long as sheep or cows. No time to see when woods we pass, where squirrels hide their nuts in grass. No time to see in broad daylight streams full of stars like skies at night. No time to turn at beauty's glance and watch her feet, how they can dance. No time to wait till her mouth can enrich that smile her eyes began. A poor life this is, if full of care, we have no time to stand and stare. Now, one of the reasons for reading that to you is that I think I am very aware that the work that we all do, we don't have much time to stand and stare. But I thought, actually, looking at this poet, do any of you know about him? Do you know William Henry Davies? Have you heard about him? Because actually, he had quite a difficult life. Wikipedia, unfortunately, called him a tramp, but I think we wouldn't want to do that these days. But clearly, he had years of homelessness. He had years of sort of difficulty. He actually ended up with a leg amputation, which, as a podiatrist, I would understand. And many of his poems, he was a prolific writer as well, were about life's hardships. So actually, towards sort of, when he came back, he was in America for a number of years. When he came back, He made sort of big efforts to get his poetry recognised and get some visibility, and he really found it quite hard. And after much effort, he did manage to find somebody who, interestingly enough, was a journalist for the Daily Mail, who actually helped him then get his visibility and get his poetry recognised. And I thought, actually, what an interesting life that is. And it will sort of be woven into what I'm going to be talking to you about later on, about really what does the future hold. I mean, I am not a mind reader. I don't have a crystal ball that will tell you what the future holds. But what I can perhaps bring to you is, from 38 years of working in mainly the health service and then in a government role, some sort of pointers perhaps from my career about some of the things that you might want to consider. So as I said, a little bit about me. So I started out from Cardiff School of Chiropody. This is a recent photographs, and I cannot believe that this lady over there actually taught me. So clearly she was there for quite some time and enjoyed it. And I spent, when I left Cardiff School of Podiatry, I went to Bristol and I worked in a number of roles in the NHS until eventually I became a manager. In that time, I actually reapplied for the job that I had twice because we used to go through regular organisational change. So, the career pathway does not always go straight. And a number of years ago, when I was talking about this in Australia, they said actually people these days have an anticipation in Australia. They might have a number of careers, while they're going through their life. However, what I can tell you is at no stage did I ever think I was going to end up in this building. So when I was managing podiatry and then subsequently becoming a sort of AHP leader within the Bristol environment, I can't say that the civil service was actually, on my list of jobs that I prospectively, would go for. But as my career developed, what did happen to me was I started looking at some opportunities, particularly when your job is up for grabs and you have to reapply for it. You need to have plan A, plan B, plan C sometimes. And one of the things that I did do was actually go on a secondment or have a secondment as part of my job, which was actually with the Department of Health in England. And out of that came a project that I subsequently did, which was about modernising allied health professions' careers. And I think that sort of really opened up the environment to me about actually, the world is not just about podiatry, it's about sort of allied health professions, therapies in general, and actually the visibility that we have, and we take a step forward and about 5 steps backwards. And that subsequently led me to think that actually it's all very well being a clinician, and I really, really enjoyed that, and I never regretted doing that. But there comes a time when actually it's a nice thing to do, not just to deliver policy, but actually to be able to influence it as well, which is how I ended up at, I don't actually work in that building, I have to say, but how I ended up working at the Welsh Government, being able to influence some of the policies that are coming out. I would say visibility for allied health professions is still not absolutely perfect, but we are living in very interesting times, and I think there are some major opportunities for us, for the future. So just sort of finish off about me, what's helped my career. So continually learning. So I have to say I wasn't the best student at Cardiff School of Podiatry. I did spend quite a bit of time in the head of school's office explaining why I had not done very well in my exams. And when I left college, I said, I'm never doing another qualification ever. And then about 5 years later, I thought, actually, I'm a little bit bored now. So I subsequently did a health education certificate, which was a sort of low grade qualification. It was sort of health education was part of my job. But actually what I did meet in the process of doing that was somebody who really inspired me, and the guy was a sociologist, and some of the stories that he would relay to us about society and the work that he was doing really got my imagination going. And I subsequently went off and did an A-level in sociology, and it sort of thereon then did a master's first degree rather. Didn't have a first degree, did an Open University degree, a master's degree, and subsequently a doctorate, which I finished last year. So I managed to do it before I retire, but and part of is the next thing is tenacity, is actually sticking at it. But it isn't really about the qualifications, it's about the journey that you go on. And I will talk to you later about my doctorate and the journey I went on with that, because that was about allied health professions and about the sort of professional boundaries that we have. So the next one was about being opportunistic. So one of the things that you sort of learn when you're a manager in the health service is nobody's going to give you anything. You have to absolutely go and look for it. And I did take some opportunities whilst I was there, and one of which was to be able to employ, to sort of set up a business case for and employ an allied health professions consultant. And it was sort of, from podiatry point of view, it was the second in the country, and it took me 2 years, and it took me bringing it up at just about every place I went to, until people used to groan when I mentioned it, but I got it in the end. And the last thing is about enjoying what I do. I don't think I've ever done anything where I thought I absolutely hate this job. And I certainly, anyone I've come across who doesn't enjoy their job, say, actually, that's not helpful to you or even the job that you're doing. So what do we know about the future? And this is from Candice Imson. You might know her. She's actually currently at the Nuffield Trust, and she has certainly written quite a lot about, the way the health service is going. And what she is saying is that over the last 50 years, very little seems to have changed. We still have a very traditional model, very medically led. No, that's not meant to be rude to medics, but it is. But actually, what we are going to be finding is that there are going to be big changes coming, and to a certain degree already have arrived. So what we know about the future is it's not going to be the same as it is now. And some of the sort of strategic drivers that, I wish I'd printed this as slightly bigger print, actually. So what we know is that there are things that actually are going to bring about quite major changes. So some of them around the workforce policies, and we're already seeing that within the NHS, in that changes with regards to movement out of hospital. The financial and the economic one, I won't have to say that to you, but we've been in a period of financial austerity since 2008, and I would argue that actually podiatry and to a degree the allied health professions have been in a period of financial austerity since about 1980, actually, because money has always been difficult. When you work in the NHS, you're always looking to reduce your budget in some way, and get to the stage where actually that is only ever staff that you can do. And then there are things like demographic changes. This won't be new to you, but clearly we have a very elderly population. People, actually it was on the news this morning. Somebody was celebrating a birthday and they were 111. So personally, I don't want to live till 111, but clearly health is such now that actually people can live until that time. And then there are changes in government policies, which I'll come back to in a while, and then things like knowledge and technology. Technology in particular is the thing that probably is going to change what we do the most. And in my lifetime, we've gone from an Amstrad computer, which did wipe documents at a sort of rate of knots, to now, some of amazing technology that, I would never even have believed could happen. So the next thing to say is, what does the research tell us? And I've mentioned Candice Imson already. So she basically has just produced a document that it might be interesting for you to look at. It's called Shifting the Balance of Care. And what they did was a sort of meta-analysis of the research data about what works. Because, within health and social services, there's lots of good ideas. But sometimes actually what we don't know is, was it worth doing, and did it work? The next one is around sort of prudent healthcare. One hopes that you have heard of that. It's been around now for sort of 3 or 4 years. And what prudent healthcare is pointing towards is a much more sort of preventative social model. So let's not just treat people, let's actually just try and help them get to the stage where they're not getting some of these problems. And that is actually now having an impact on the way that we deliver services within Wales. And I say I'll go into that in a little bit more soon. And then professional boundaries. So, as I said, I did a doctorate, and it was about what determines professional boundary change. And I did a comparison between what goes on in England. I couldn't do it in Wales because I would have had to talk to myself, as it were. But I spoke to policy officers in England, and I also spoke to policy officers in Australia, and similarly with multi-professional groups and uniprofessional bodies to talk about their experience of it. So it was qualitative research. And the end result was, what are the two things that actually do affect professional boundaries? And the two things that came out for allied health professions was opportunity, so being opportunistic in taking, when opportunities come up, taking them, don't hold back, and also policy as well. If you can influence policy, those are real levers to help you change professional boundaries. And it was very interesting, for me, obviously it was my subject, it was a very interesting piece of research because what I did get into is actually the whole thing around professions and how they develop. And I think, for you as, being part of some of the smaller professions, it would be an interesting thing for you to look at because it is actually about professional boundaries are changing all the time. And, certainly from my point of view as a podiatrist, I would argue the professional boundary between us and the medical profession has been a difficult one, but actually, and it's taken years, there is now movement where podiatrists are doing minor operations that they wouldn't have currently done sort of like 20 years ago. So I'll sort of leave that with you because I think it is a good thing to remember that actually things are not static, and that sometimes when you feel, we're getting nowhere with this, actually just remember that things do always change. So I mentioned policy. So from a policy point of view, what is out there to help us? So in Wales, we have this marvellous piece of legislation, which is the Wellbeing of Future Generations. And basically, this was about looking, let's not just look at now, let's look to the future. And what it has produced is a much more sort of cross-government approach. So I've worked with ministers, say, for the last 6 years, and, I would say the health minister was doing the health bit and social service bit, and the culture minister was doing his bit. And actually, the more recent approach has been about let's work together, because actually this is about the whole of the generations, not just sort of silo working. And sort of central to this is that let's produce things that are sustainable as well. So, it isn't, when you think about health problems, actually looking at where people live and the sorts of environment they have and the communities they live in has an effect on their health. And that's not new information, that's, public health. It's been around for a long, long time, and certainly coming from Bristol, they did some very interesting studies on the local population and how the sort of environment affected them. But central to this is about well-being. So it's not about treating people who are sick. It is, we do need to treat people who are sick, but it is about actually let's try and make sure that central to what we do is keeping people well so that actually they don't need to use the services that we've got. So, I'm a slide behind. So those are our well-being goals. That's not a very, it's not a very good slide, and I can't really read it from here actually. But central to that is a healthier Wales. So a society in which people's physical and mental well-being is maximised, and I'll go into that in a minute around the policy that sort of sits around that, and also that sort of the choices and behaviours that people make benefits future health. So when we've been working with the health service in particular, and to a degree social services, about bringing prudent healthcare to life, I think one of the things that probably hasn't happened is that the public don't necessarily understand what that is. So in actual fact, they will turn up a GP practice and expect to see a GP with a back when they've got a back problem, should we say, and when they see a physio, they think, why am I seeing a physio? Because I wanted to see the GP. But in actual fact, the physio is going to be able to solve their problem rather than going via a system. So recent policy documents, let's make sure I've found up. So these two, one, Taking Wales Forward, is actually the programme for government. So each time a government comes in, they will have a programme for government. It's not just Wales, right the way across the UK will put together what their policy direction is. And prior to that coming out, we had a plan for primary care. So if you don't know this already, the big change in direction for health is about keeping people out of hospital, trying not to get them into hospital in the first place, and actually that is all going to go on in primary care. So to a degree, we've had services that are actually running community services, and running them in primary care now is a different sort of cultural move, because the actual sort of model within primary care is also changing as well. So going back to the programme for government, these are cross-party themes. And have any of you read the programme for government? Somebody said yes, marvellous, marvellous. So it's not very long actually, and it is, quite an interesting read. You won't currently find the arts therapists in there, but they sort of are. And I say these are the 4 areas that they're looking at: prosperous and secure, healthy and active, ambitious and learning, and united and connected. And the delivery of therapies is probably, apart from perhaps the last one, in most of those, because it has impacts on all those different areas. So it would be an interesting read. So it's not very long, because it highlights specifically some of the areas that they'll be looking at. And one of those in particular, I didn't bring it with me, is actually around mental health. So there is a desire within Wales to make a difference within mental health, and that isn't just with sort of traditional approaches, that is about opening up actually some of the other approaches as well, and I know that will be pertinent to you here. So if I go on to primary care, so primary care plan is about planning care locally, so it isn't about planning hospitals, and what you'll find within the programme for government is the idea is to develop centres that are not hospitals, that are actually to do with health and well-being, but won't be hospitals. The second one is about improving access and quality. So improving access is not just about the GP working more than 9 till 5 days a week. It is about actually a more multidisciplinary approach within GP practices. And if any of you know what's going on in North Wales had a bit of a difficult time over the last year or so, and have been in special measures. But actually what they've managed to do is really turn around some of their approaches within North Wales, because they've sort of had to. And somebody said to me the other day, don't let's waste a good crisis. And actually, with firstly not being able to recruit GPs, and secondly, in some cases, having a whole town where the GPs handed in their contracts and the health board had to take that over. And what that allowed them to do is completely re-profile what's going on. The town is called Prestatyn, and it's certainly worth a look at how they're developing, because the interesting thing about Prestatyn is it's not just about GP practices, it's about the community, it's about the arts centre, it's about social prescribing, how people come into the service. The multidisciplinary team consists of a GP, but also a pharmacist and an occupational therapist, a physiotherapist, and in some areas, some others, counsellors as well. Because actually, rather than a patient coming in to see a GP when they've got sort of, lower level depression, why not go and see the occupational therapist who can help them get either back to work or help them get to the stage of actually how do I get into this rather than just treating it. Initially it was met with, I thought I was seeing a GP, but actually the feedback now, having been doing it for over 6 months, is much more positive, because what patients are saying is that actually we got to grips with what the problem was rather than just treating my depression. And also it meant that they weren't going all around the houses to see different people as well. So watch that area with interest. Then we were talking about equitable access. So one of the issues is that it tends to be that in deprived areas, South Wales Valleys is one of those, Actually, people don't seem to go to doctors when they've got problems. So there's something called the inverse care law, whereby people with the most need tend to be the least ones who go to see the doctor. So it is about making sure that the access is appropriate as well. And then skilled local workforce. So part of what Welsh Government is doing at the moment is looking at what does that workforce look like. So, and it isn't just doctors, it isn't just nurses. There is a whole gamut of allied health professions involved with that, as well as other professionals as well, pharmacists, even to looking at things like eye services and hearing, etc. If you haven't, in my mind, if you're not inhabiting a bed in a hospital, I don't really see why you should be in one. So this is actually about much more about services being done closer. One of the issues that we had, and I have to say, it's not a particularly new idea. People have been trying to, or managers have been trying to get services out of hospitals for a long time, but then we hit the barrier or the problems of the estates. So, where do these people, have these services? And interestingly enough, I was out with the Cabinet Secretary a couple of weeks ago, and we went to Llantrystant Sports Centre, where they were delivering a sort of group activity around back problems. So this is actually about some of thinking outside the box. You don't necessarily need to be in a GP practice. You don't necessarily need to be in a hospital. There are other areas, places that you can go to. And then the last thing is about strong leadership. And, I think this, probably for the allied health professions, we've taken steps forward, we've taken steps backwards. We're very fortunate in Wales, I think, to have close contact with ministers. I myself see the Cabinet Secretary on a regular basis and, have a face-to-face conversation about, developments and, perhaps some of the opportunities that we can take. I know when I worked in England, they had a fantastic setup with a sort of my equivalent there. And they had strategic health authorities right the way across the country who had allied health professions in them. And then a new government came in and it was all disbanded. So this is about, there are some disappointments on the way, but actually we have to keep at it. So just wanted to talk to you a little bit about sort of primary care modernisation. So this is actually about, modernising our roles as allied health professions and therapists. And this is actually about looking at care pathways and how they might be developed within primary care. So that will mean some changes in thinking and some approaches, and it might be some discomfort. I think people coming out of university now probably won't notice the difference, but people like myself who've been around for a long time, sometimes you think, I've done that before and didn't work, but actually this is a new day, and we need to be looking at sort of new methodologies. So this is about workforce that's got appropriate attitudes and aptitudes, and part of that is looking at our skill mix. So for me as a podiatrist, I came out of university or college and I went straight into what would then have been a sort of band 5 job. To be honest, I think I was in it for 2 minutes, and then I went on to band 6 because there was a lack of podiatrists. These days, there are podiatry assistants, there are healthcare assistants, and they are delivering things that I probably would have delivered when I trained as a podiatrist. So toenail cutting was one of the things I did an awful lot of, but we didn't have the population that we've got now, and we didn't have the problems, and the world was quite a different place. So it is about actually, from our professional point of view, what direction are we going in? And certainly, when I was doing my research, what I did find was there is a little bit of resistance to give stuff up. So we still have podiatrists who still want to do toenail cutting, even though it's perfectly okay for now, actually, the charitable sector to do it. Age Concern do toenail cutting because that allows podiatrists then to do the work that they are really good at, which is working with quite severe foot problems, particularly in areas of sort of diabetes. And then there's this issue about breaking down professional barriers where appropriate. So, we don't like to admit it, but we still do have some little battles between professional groups. And I think, when we start putting the patient at the centre, actually those disappear. And again, I won't be around to see it, but there will be new models emerging where actually you get some blurring of boundaries between different professional groups. So in Australia, there is an interesting role called a transdisciplinary role, because in Australia they've got vast areas of rural places that, you know, you can't have a whole swathe of professionals sat there waiting for a patient to turn up. So what they've done is looked at it from a competence point of view. So if you develop some competencies, they actually, if you're a physio, they actually might be OT competencies, and that, you know, nobody gets in a state about, oh, are you trying to sort of take over my profession? Because actually that's what's right for the profession, that's what's right for the patient, sorry. And that leads on to the flexible workforce. So this is much more now around being open to what do the patients require. And say, my previous job was with an organisation called Skills for Health, where we did workforce planning. And what we found was, if you started with a patient and then worked out what competencies are needed to deliver whatever this patient needs, and then who's got them, you actually end up with a different profile of your workforce. And then it remains to be seen, you know, clearly continued professional development, advancing technology, evidence-based practice. I mean, that's an interesting one, I think, for some of the therapies, are all part of what's, you know, necessary to carry on. So I'm going to whiz through this a bit now, because I think I'm massively due to go over time. So the sort of new changes that we've got are about co-production, so the patient at the centre of everything, but around that is a relationship between the NHS, the government, and also the public, and where each of the responsibilities lie as well. I put a slide in here about prudent healthcare because, you know, I say the previous minister used to mention it every sort of other word. And actually, this Cabinet Secretary, Vaughan Gethin, is still very much aligned to this. And I think from a therapy point of view, we should be encouraging it as well, because it very much fits with the therapy model of actually, you know, smarter use of resources, not just sort of doing the same old. And actually, it's not about rationing, it's actually about a conversation with patients and about what they need and what they require. So those are the principles, and then clearly central to this is about co-production. I think this is a very interesting topic for some of the professions. I think we definitely haven't arrived at this. I think as therapists, we probably think, well, you know, this is us, this is what we do. But I wouldn't say, again, that with all professions. And certainly for me in the past, I might have well said to patients, you know, I did 3 years training, you know, so I'm giving you advice. If patients don't want to take it, that's their responsibility. But I think actually now this is much more about having that conversation and, you know, arriving at an understanding of where we both are. So some of the enablers that we've got, as I say, some of the policy is going to help us actually sort of push this forward. And, you know, the workforce side of primary care is going to be looking at sort of driving new roles, looking at service redesign. You know, that's very much the push forward. Say, we're a couple of years down the line now, so this slide probably is not quite as shocking as it might have been. And this is about individuals making decisions based on the evidence. You know, we all know people have much more access to the internet these days and looking at options. So, you know, you're not dealing with now an ignorant public. And finally, it's about looking at perhaps some new types of evidence. So we had a discussion in work this week about evaluation and how evaluation should be part of what you do with your service, not just, oh, I think I might do it, because actually we need to know what works and what doesn't work so that we can stop doing stuff that doesn't work. So what next? Where are we going? And one of the things about the Future Generations Social Service Bill, various programmes for governments coming together, is that actually, you know, this is about sort of public value and also about looking at public health, so looking at a wider approach, not just about treatment. Prudent healthcare will sort of help and provide a sustainable health system. If people are working at the top end of their licence and not doing things that they don't need to do or shouldn't be doing, then actually the health service will be all the better for it. And And this is actually about sort of not just about the disease, about some of the related complications as well. I've already mentioned the model in prostatin, where actually if you can start looking at what's caused this problem rather than solving it, you're quids in for, helping that patient. And I just wanted to bring this to your attention because Rebecca Evans, the Minister for Social Services and Public Health, launched this for us last week, which is basically a strategic framework for allied health professions. Have any of you come across it? Yes. Marvellous. I'm totally reliant on you. There is. I'll send you a link to it. Actually, I've only just sent it out to the sort of general allied health profession population. But what this document says, it's a vision for public health is part of all our jobs. So it's not a sort of discrete area. In some cases it is, but actually as allied health professions, as all the therapists, public health is of interest to us, and it sort of gives some goals and some directions for, it's very generic because obviously I cover 10 professions and this covers slightly more, but what we'll have the opportunity to do is for each of the various professions, and that includes psychology, to look at what it might mean for them, and there'll be a task and finish group run by the Welsh Therapies Advisory Committee to do that. So pressing on to, I'm coming towards the end now, but just to sort of highlight some opportunities I think are out there. So I've already sort of mentioned this, so some of the emerging models, shifting care out of hospital, we haven't cracked that yet, but we're certainly, on that road. Social prescribing, this is a word that I'm sure, be hearing an awful lot more of, whereby actually this is about not a medical prescription, not a pharmaceutical prescription, but actually a prescription to something that will help somebody within their community. And I certainly see the arts therapies as one of the areas where this is something you should be looking at. And also about developing communities as well. So there is a great keenness now that actually people do live in isolation, and the support of the community is really, really important. And what part might we play as therapists within that? So some of the opportunities as professionals, I sort of throw this in as something to consider. So extending skills. So at the moment, I probably wouldn't know what that means for an awful lot of you, but that's something for you to be looking at. What sort of things, what areas might you be looking at to extend what you already have as skills, and what might you be going into? There's a lot of talk around cognitive behavioural therapy, mindfulness, etc., resilience, all those sorts of areas that you'll be hearing an awful lot more about. Take the opportunity to be involved with it. Advanced in practice, there are sort of professions within the allied health professions that probably have had more traction with this. Clearly physiotherapy have done very well out of this, and what they are doing now is extending and advancing their practice into specialised areas of looking at knee problems, injecting, they've got independent prescribing, and are using that to great effect within GP practices. And then skill mix, I've already mentioned that. I'm not sure how well developed that is in some of your professions, but it is an area that you really do need to look at. And then also around prudent care, which is actually about working to the top end of your licence. And if you work to the top end of your licence or are working towards that, the skill mix bit will come out of that as well. The next opportunity is about innovation. So again, I can't tell you what that might be within your arenas, but this came out of the CEO of Pepsi, so I think he probably knew what he was doing. The future belongs to those who see possibilities before they become obvious. One of my experiences when I was a manager was I was not the person who had the ideas. Actually, it was the frontline staff, and in many cases, the newly qualified staff who came out with really enthusiastic ideas. Let's see if we can utilise some of those, because there will be little areas there that actually will turn into big areas of development. And, I really encourage you, particularly here as a university as well, to be thinking about those. And then your opportunities to influence. So this is a very, very important one for you. Who basically is going to champion your cause? Somebody's already said to me, the arts therapists are quite a small group. Well, they are, but they're not necessarily the smallest. And there are small professions, if you look at speech and language therapists, who have actually been very successful in influencing, even though they're only a small profession. So who are your champions? And I think, you need to be considering who those are. Hopefully I've been one of them, but I'm not here for much longer. So it'll be important for you to be making an appointment to see whoever comes in to take over the Chief Therapies Advisor's post. The Welsh Therapies Advisory Committee is a very important one for you. You have representation on it. And I was saying earlier, these committees have gone through a period of, shall we get rid of them, shan't we? Well, the news is we won't. So this committee has direct access to the Cabinet Secretary and the Minister for Health and for Social Services and Public Health. So use it for, the areas that you would like developed. And then within the NHS, you have Directors of Therapies and Health Science. Make sure if you go into the NHS at any stage, make sure you know them. Even if you're not in the NHS, they are always a useful group to, have some contact with, because they are influencers. And then I threw in lobbying ministers at the end of that, because what we have in England, they have something called the Allied Health Professions Federation, who go and lobby. Arts therapists are represented on that. I don't think psychologists are, actually, but they will go and lobby ministers, because ministers in England refuse to see individual professions, because that's how they work. But in Wales, we don't have an Allied Health Professions Federation, because the policy officers from the various professional bodies decided that actually they wanted to be a bit more inclusive. So they've involved social workers, they've involved pharmacists. I'm not sure if they've involved psychology. They might have done, but if not, I would encourage you to get in contact with them. And they are in front of Cabinet Secretary and Ministers frequently. And I know this because quite often I have to go to the meetings with them. And they will present to the Cabinet Secretary what they think the problem is, but they also come with a solution, which is exactly what they like, ministers. They don't really want to hear problems. I mean, they have to as politicians, but they want to know what you're going to do about it. So keep that in mind as, and it isn't necessarily about money. It's about actually where you can get into areas of work. So I think you'll forgive me, the professional people who are representative professional bodies here, you'll forgive me if I say I'm not aware of the arts therapists ever being in front of the Cabinet Secretary as an individual group. So that is something that you might want to think about, because I think he'd be very interested to hear from you. He is very aware of issues around mental health problems. As I say, I would encourage you to do it. When I was doing my doctorate, there was something called, there was a model called pathway dependency. Has everyone ever heard of it? And the idea, somebody has? So the idea behind pathway dependency is that you are heading in a direction and then something comes along and knocks you off. And sometimes that can give you opportunity and sometimes it can muck things up. So interesting enough for you as arts and psychotherapists, something has come along that will help you. Hopefully you will be aware of this, that Ken Skates, Minister for Culture and various other things, delivered a vision in December. Have you come across this? Yes. Can rely on you every time. And arts therapists are actually significantly in this document. So what they've done is use the programme of government and the 4 areas that I talked to you about to put in, and under the Healthy and Active, obviously what he is keen to do is bring together arts and culture. So for you, there's not about just influencing the health social care ministers, there's also other ministers that you can now actually have an input into. And I do know there is a cross-party group who is looking at this, and I do know that there is an arts therapist on it who is a very good ambassador for the profession. So, but this is all about thinking outside the box. So, I don't necessarily think I would have thought of Ken Skates as somebody who could help your cause. But hey-ho, it's in there, and I think, he'd be very interested. And actually, I can put you in contact with the policy officers, who probably kill me now, who will be leading on this, and would be very interested to hear about, some of the thinking. And then a couple more. How am I doing? Oh, better rush on. So opportunities to get involved. This is sort of more about involvement within, I suppose, the health sector. But taking opportunities to get involved in things like induction, not just for your own professions, but actually for other professions. You possibly do this already, but certainly we don't want people just sat in their own sort of professional silos. Supervision, that will be one that you will be very aware of, but it is one that is being now looked at much more closely within the sort of health sector because it's a necessity. And then peer support and training development. And training development, we for donkey's years, we had a battle on to get any support for allied health professions. But actually, I've come to Wales and we have an organisation called WEDS who have identified funds for training for allied health professions. So use it. If you work in the NHS or have anything to do with the NHS, use your managers to talk to people in WEDS about what sort of training development might be available for you. There's a very interesting one at the moment about health outcomes and about it's by a lady called Kate Malcolm-S, but she's done a lot of work on stratifying services so that when people get sent into services, they don't necessarily see the specialist as the first step. What they see is the right person for, their particular problem. And then the last one is about opportunities to develop the evidence base. So when I was researching this piece of work, I came across, so CPD clearly is essential and it is something that you will do right the way throughout your career. So for me, who thought I'd never do any education after I left college, clearly that was not the case. Around research, so now have I got the right slide up? Yeah. Andrea Gilroy, I don't know if you've come across her. I haven't. It was only just on the internet. She's written this book, Art Therapy Research and Evidence-Based Practice. I think it's worth a read because actually what she was doing was challenging the medical model. So I all for it because actually the evidence that's produced, it's not all about randomised controlled trials, even though when you read various books, you think that's what it is. And in some ways, unfortunately, the therapists perhaps don't have enough of those, but there are other ways of collecting research to show that your services work and that your inputs, have positive outcomes. And then there's academic careers, which is a little bit of a shame because it's not something that I've managed to really get off the ground because with 10 professions, there's been some other pressing issues to deal with. But I'm here at a university, so it is something to be thinking about, the relationship between people working within the front line and actually how they develop their academic careers. So I'm going to finish on this last quote from Charles Darwin, which is about, it's not the strongest of the species that survives, nor the most intelligent that survives. It's the one that's the most adaptable to change. And I think that will be true right the way through, those of you starting out in your career and those of you who are halfway through or coming to the end, because actually that's what we need to do, is to be adaptable to change. So I'm going to finish there. There is about 5 minutes left. I just sort of put a last slide up, which was perhaps some issues to consider. I don't know, I thought if I run out of things to say, we can have a jolly good conversation about this, but I'm longer-winded than I thought. But I think these are some of the things perhaps for you to take away with. What does it mean to be sort of politically aware? Do you understand how you can use this sort of small p political environment to help you and to help more to the point, help your service users or your patients? Where can you influence? I've sort of given you some pointers about that, but thinking outside the box, are there other areas? Professional boundaries, so there are new roles coming out. One of them, mental health practitioner. Have any of you thought that these are the sort of thing that you might move, your career into? and then who are your champions and where are your opportunities. So thank you very much for inviting me to speak here. This is possibly the last sort of big presentation I'm going to do in my career. So I'm delighted to have finished it with such a lovely group. So thank you. Yeah, sure.
So I'm not going to be heard there, am I? On behalf of all of us here at USW, I'd just like to say a really massive thank you. I'm even more honoured now, knowing it's your last one, Alison, and how fortunate are we. I have to say I found that truly inspirational, and I think many of us here, in a period of massive change within our own university, will recognise a lot of the things that Alison has been talking about, and I think we are poised here at a point where we can really embrace a lot of what you've been saying. Intra-faculty, across the whole university, in fact. So thank you very much indeed.
You're welcome.
And one other thing to say, I think if Helen had been here, she would have also found you inspirational, because you have a very like mind.
Oh, excellent,
So,
excellent.
We just have a few minutes for questions. So if anybody'd like to ask Alison anything, please don't be shy. I've got a question.
Oh, that's unusual.
I'm just wondering about something that perhaps you might have a bit of an insight into. At the moment in Wales, we've got this split between psychological therapies, where the allied health professions, which also includes arts therapies, are very much involved in all of this. And then we've got counselling, psychotherapy, counselling, psychology, and so on, which are a little bit to the side. And it feels like a massive shame not to actually be together in all of this. So I just wondered whether you had any ideas in relation to how to come together, whether there are any opportunities within the advisory structure in Wales, or actually right across the different professional groups and so on for us to actually do that.
So the Welsh Therapies Advisory Committee has psychology on it as well as the arts therapists. So that's one to land. Counselling, and unfortunately, obviously we get into situations of regulation, and that's not necessarily rules that I've made up, but the advisory committee covers the HCPC regulated professions. So counselling doesn't necessarily have an in to that, but what the Welsh Therapies Advisory Committee is it's fed by a whole series of networks, and there's no reason why counselling as a network can't feed into that, so that art therapists can actually bring to the table some of those ideas. Within Welsh Government, I'll be shocked for saying this, but we do work within sort of areas of which could be viewed as silos, perhaps less so now. But covering 10 professions is enough for one person, and I don't have a sort of policy team around me currently. There might be changes in that, when the next person comes in. But psychology and to a degree counselling is covered by the mental health area, so that sort of places it into a silo in itself. And I think perhaps I haven't had as many conversations with the lead from mental health as I should have done. To support myself, is psychology only recently came into the Welsh Therapies Advisory Committee, because for some reason it had been in the scientific committee, but it didn't really get much traction there. So I think this is an opportunistic time to actually perhaps sort of revisit that, and there are some benefits with it being within a policy area of mental health, because I think it's a lot of the area you work in, but it's about working with a number of people in Welsh Government rather, and I've talked now about policy officials from the arts side as well, so it's a number of balls in the air, but keeping those going, and I think perhaps being more assertive as professions to get those contacts. The one thing about Welsh Government is it's contactable. I mean, you would never get that in England, but we have questions coming in from all sorts of directions that, the minister doesn't necessarily answer, but somebody in Welsh Government will. That we have to. It's our responsibility to do that.
I'd like to thank you for your very interesting overview talk. I'd like to ask you about something you touched on slightly, and that is the impact of information or technology delivered services. And there's an obvious conflict at times, I think, between technological delivery of services and interpersonal delivery of services.
Sure.
And we therapists tend to feel that the interpersonal element of therapy is very important. And you probably know the IAP services in England, where I actually come from.
Yeah.
I believe some errors were made in there, and I would like to. It's a plea, really, but you know, in Wales, don't make the same mistakes that were made. And I would love to hear government people affirming the importance of the interpersonal elements of what we do.
So I think the tip there is to get yourself known in primary care, because you know, primary care is the place where these in the future will be delivered. And I don't think there is as much traction. I don't know why, but you know, what we've been able to do there's been money launched, there's been money put into primary care. I was saying to Blanca earlier that when GPs were surveyed, the two things they wanted was pharmacists and actually counsellors. They don't necessarily know what they need, I think, perhaps. So there's opportunities there to start setting the scene for what potentially could be delivered there. And I think, I totally hear what you're saying. I had some involvement with IAPT in my previous job in trying to develop a career framework for the talking therapies, but it wasn't the easiest thing to do. There was some resistance to letting go of some work that could go to, you know, a skill mix. So I think it takes stepping back from your profession, I think, to look at what opportunities there are. But I do think primary care, and that's the question about being politically aware, primary care is the area that you should be seriously looking at the moment, I think. But thanks for the question.
Thank you very much again, Alison.
You're welcome, delighted.
We wish you all the very best in your retirement.
Thank you. Thank you
Sounds
very
like it's
much.
very well
I'm looking forward to it.